Okay, now we're going to look at ear diseases. First, we'll start with otitis externa. So we've all probably seen this in practice. It's very common, but interestingly, it can be caused not just by allergies, which is what we normally see, but it can also be caused by parasites, foreign bodies, polyps, tumors. We're going to go into everything. Endocrine abnormalities and keratinization disorders can also cause this. So we usually use antibiotics and corticosteroid ear drops to treat this, but it can be chronic. I've seen chronic cases a lot. So you can continue this treatment, but you might eventually have to do what we call a TICA, total ear canal ablation, which we'll go into in the next slide. I've got some pretty neat photos here, but we'll carry on. So next we have ear mites. I didn't really want to show you an actual photo of a mite because it's disgusting, and I know I showed you a couple of gross ones. So yeah, ear mites, they're usually in young small animals. The species, I'll show you the name because I don't want to say it incorrectly, Otodectes cynotus parasites, and they're usually spread by direct contact. So what do we get? We get pruritus, so accumulation of dark brown or black cerumen, if you're not sure what the word looks like, because I've never seen the word before. So diagnose obviously with an otoscope and taking some samples, so you could like do some microscopic identification using a mineral oil lens. And we'll treat this pretty much every 3 weeks, I assume with some kind of antiparasitic. Next we have otitis media and interna. I'm sorry I couldn't find a better picture, but let's stick with this one for now. So for dogs, it's usually caused by otitis externa, basically extending deeper into the auditory canal, and it does this through a perforated tympanum. So I think the tympanum is the eardrum, if I'm not wrong. In cats, it may occur because of an upper respiratory tract disease, eustachian tube infection. If you're not sure what I'm saying, just follow with me here. Now, if this occurs, like the causative agents are usually really severe things like Pseudomonas. I've come across this in practice. It's like really hard to cure. Staphylococcus, Streptococcus. Malassezia is a big one because, oh dear, I did something I wasn't supposed to. There you go. So Malassezia, I won't click it, is a fungal infection that usually occurs because of previous infections, because imagine like a fungus thrives in like hot, humid environments. That usually occurs because of a previous infection being there. And you obviously would treat these because most of these are bacteria with amoxicillin and other antibiotics. And yeah, if it's chronic, TICA. Generally, if you're not sure for ear infections, it's TICA. As a treatment, I mean. Now, foreign body, we can understand the clinical signs. I think you can kind of bullshit that. In a chronic sense, though, you may get otitis media because the foreign body may have migrated. So yeah, how do you diagnose it? Obviously, seeing the ear itself and flushing the canal. Remove it with forceps. Sorry, I don't have a picture, by the way. And yeah, treat it with antibiotics and corticosteroids as you would do with, say, otitis externa. Now, let's get a picture up because it's been a while. Next, we have inflammatory polyps. The reason we're showing a cat here is because they usually occur in cats. So they usually occur in the mucosal lining of the middle ear, the auditory tube, and the nasopharynx. And it's usually associated with other diseases, actually. So we may see a cat coming in sneezing. It's got rhinitis, otitis, from a bacterial or viral agent, but we might not even think it's a polyp. You would really only see it through, sometimes through otoscopy. You might see a pink or grey spherical mass occluding the canal, but not always necessarily. Maybe you need like a MRI, sorry. And yeah, we would treat this basically by something called traction avulsion after incision in the vertical ear canal, or doing a ventral bulla osteotomy. Basically, you cut into the area and remove the polyp, but I'll show you how to do that in a bit, sort of. Tumors, so we know a polyp is just like a benign tumor mass. I'm just saying that just in case people don't know. A tumor, a regular tumor is more of a malignant thing that would spread. Obviously, it's usually in older animals. You would get discharge from the ear and local pain. Obviously, you'd need x-rays to see it. Oh, okay, so not just MRI. That's my mistake, sorry. And yeah, for benign ones, you would remove otoscopically. Malignant, you would do a TICA. Now, I keep talking about these surgeries, but how do you even do them? So this is a total ear canal ablation, not the whole surgery, of course, but once I tell you how to do it, it's quite self-explanatory. So you'll do So this is obviously, like I said, for chronic otitis, for cancers, just as a refresher. So what you'll do, you'll cut a T-shape, and what you'll do is basically not only cut the T-shape, but you'll continue to go around the opening of the ear canal. And what this is called, this purple thing, is the vertical ear canal, and you're going to cut around the proximal and the medial vertical ear canal until you get down to, I will call it the root. This is the external acoustic meatus. You're going to cut that off and basically stitch all that up, and that's what a TICA is. And what you do as well is not only stitch it up, you'll place a drain, because now that this is missing, you'll have dead space there, so you need a Penrose drain. Now the ventral bulla osteotomy, I think we only said we would use that in the case of a tumor or a polyp, something like that. So how do we do that? I'm not going to go into massive amounts of detail because I don't know much about it, but I've circled this muscle specifically. As you can see, it's at the base of the ear. You would incise the muscle, and under this muscle is something called the linguofacial vein, or vena linguofacialis, and you would just retract it out the way and deepen the incision. And what will happen is you'll deepen the incision until you reach something called the bulla, which is, I assume, part of the auditory apparatus. And you'll use something called a Steinmann pin to make a hole on the ventral part of the bulla and enlarge the opening with a small ronger. I know what I'm saying, but if you don't, just Google some of the stuff I've said. It's all in the slides. And yeah, then you flush the cavity and use a Penrose drain again.